I'd like to introduce you to Dr. Raphael Rettner. Dr. Rettner is a Palmer College of Chiropractic West graduate and has been in practice since 1982. Dr. Rettner is a highly skilled chiropractor. He has made numerous radio and TV appearances, is the author of over 37 ebooks, and has produced 28 DVDs, including 3 Phases of Healing After a Whiplash Accident, FAST, Fascial Alignment Stretch Technique, and 12 Causes of an Unstable Spine. Please welcome Dr. Raphael.
Tonight we're going to be talking about the opioid epidemic, and what I'd like to propose is a multidisciplinary approach to treating chronic pain and drug addiction. So as a chiropractor, I like to relieve pain in the musculoskeletal system. And I also want to work with therapists who want to work with the underlying emotional cause of the addiction or the chronic pain that's come from chronic pain. And also, as therapists, I want you to teach mindfulness meditation, because there's been many studies on how mindfulness meditation will reduce pain. And I also want to find medical doctors who are willing to wean the patients off the drugs, because we need a team approach to really help improve lives and even save lives. I'm going to see a show of hands. Anybody here know what the biggest cause of death is under age 50? Anybody can guess? It's overdosing on opioid drugs. In 2016, 64,000 people died in the U.S. because of opioid overdose. Now that's, to put that in perspective, that's more than men who died in the war in Vietnam in 1 year. That was several years that it took. Now the CDC, the Center for Disease Control, estimates that 125 people die each day of opioid overdose. And in a month's time, that's the equivalent of the same tragedy that happened on 9/11. And tonight I'm going to talk about
1. The cause of the opioid epidemic. 2. How the government is helping the drug companies make more money. 3. The 3 categories of pain. 4. The 7 natural effective ways of relieving chronic pain.
I want to talk about a patient of mine who he worked for Kaiser. He was lifting some heavy equipment. He often had level 10 pain. That's the highest pain you can imagine, and was on pain meds for 6 years. So these are in his own words.
I got no relief from the pain and became hypersensitive to pain. The meds didn't help, but knocked me out. I was unable to regulate my sleep between the pain and the meds. I was depressed, lethargic, and had a flat affect due to the meds. I couldn't be in a relationship or go on trips because I was unable to move and had no libido. I felt I was going to die.
Now, after just a few weeks of chiropractic care, he said,
now I'm able to move without pain and have increased flexibility. I can feel again and have hope for the future.
So this is what typically happens with the opioid medication is the majority of these people have lower back pain. They take the drugs, they're lethargic, they sleep on a couch all day, their lives are worthless. They're just lounging around, and the drugs, after a short period of time, don't work. So they're in pain, it's not helping, and the drug companies are making lots of money because they're still taking those drugs. There's 3 types of pain. Acute pain, which lasts less than 3 months, chronic pain, which is 3 months or more, and intractable pain. Intractable pain is so severe that it dominates every moment of a person's life. There's statistics that say 100 million of the Americans are suffering from chronic pain. And this led the drug companies to say, why don't we push these opioid drugs on more people? Let's make more money here. Because it used to be they just gave opioid drugs to people who are dying of cancer. And if you're dying, it doesn't matter if you're addicted, you're going to die. Okay? And you get some comfort from these things. But if you just have chronic pain that can be helped with something else, it's unethical to give people these drugs because they're going to get addicted to it and they can die from the drugs. These drugs include OxyContin, Percocet, Vicodin, and fentanyl. Now, fentanyl is 50 times stronger than heroin. The rock star Prince was being treated for opioid addiction. He died from an accidental overdose of fentanyl. Tom Petty was suffering from an unbearable pain because he broke his hip in his last tour. He also died from an accidental overdose of fentanyl.
New details tonight about the deadly mix of prescribed drugs that killed rocker Tom Petty.
We're also hearing from the singer's family about his health issues.
CBS 2's Tom Wade is live on the Hollywood Walk of Fame with more. Tom?
Yeah, Pat and Rick, as you can imagine, so much heartbreak out here on the Hollywood Walk of Fame. Here is Petty's star. There are no candles or flowers out here tonight, but a lot of people coming to pay their respects and talk about his legacy and also to ask a lot of questions. The cause of Tom Petty's death is reopening a painful wound. The LA County Coroner's Office says Petty died from an accidental drug overdose as a result of taking a variety of medications. Petty's family says the legendary rocker suffered greatly because of a fractured hip. Dr. Joseph Harazzi specializes in addictive medicine and forensic psychiatry.
Apparently he suffered from such severe pain that he combined OxyContin with fentanyl. And what we must keep in mind is that fentanyl is 50 to 100 times more powerful than morphine.
The coroner's report also says Petty had emphysema and clogged arteries. He was also being treated for anxiety and mixed all of his medications together.
The benzodiazepines, Xanax and Restoril, which he was also taking for anxiety, that can be a lethal mix.
Petty's widow and daughter released a statement in the wake of the results. He toured for 53 dates with a fractured hip, and as he did, it worsened to a more serious injury. On the day he died, he was informed his hip had graduated to a full-on break, and it's our feeling that the pain was simply unbearable and was the cause for his overuse of medication.
His family, his wife Dana and his daughter Adria, brought out the fact that unfortunately this is part of the bigger issue, the opioid crisis.
The opioid crisis also claimed Prince and tens of thousands of other lives across the country.
In 2016, we had 64,000 overdose deaths.
So opioids are synthesized to resemble opium-derived morphine and heroin. Basically, it's synthetic heroin that they're giving. And 8 out of 10 heroin addicts in the U.S. began their addiction with an opiate prescription for pain. Now, there was a long-term study done at the Minneapolis VA Center, and it was reported in the back letter. The study reported a 12-month follow-up. They found that people who were on opioid drugs had more pain than the ones who weren't on opioid drugs, the ones who were taking these NSAIDs, the non-steroidal anti-inflammatory drugs. The reason I'm talking here tonight is I went to my friend Michael's house back in October, and we watched 60 Minutes episode on the opioid epidemic. And during that episode, they were interviewed a former DEA agent called Joe Rettner. He saw the opioid crisis growing, and so he wanted to do something about it. And what he saw was unethical medical doctors and pain clinics that were prescribing like crazy. There was and pharmacies. As a matter of fact, there was one example they gave. Kermit, West Virginia, total population 392, had 9 million prescriptions for opioid medication in 2 years.
Joe Rettner is a tough, blunt former DEA Deputy Assistant Administrator with a law degree, a pharmacy degree, and a smoldering rage at the unrelenting death toll from opioids. His greatest ire is reserved for the distributors, some of them multi-billion-dollar Fortune 500 companies. They are the middlemen that ship the pain pills from manufacturers like Purdue Pharma and Johnson & Johnson to drugstores all over the country. Rettner accuses the distributors of fueling the opioid epidemic by turning a blind eye to pain pills being diverted to illicit use.
This is an industry that allowed millions and millions of drugs to go into bad pharmacies and doctors' offices that distributed them out to people who had no legitimate need for those drugs.
You know the implication of what you're saying, that these big companies knew that they were pumping drugs into American communities that were killing people.
That's not an implication, that's a fact.
Distributors are the companies that ship the drugs from the manufacturers to the pharmacies all across the country. They are required by law to keep track of every single pill they ship. And they're also supposed to alert the DEA of anything suspicious, any suspicious shipments. An example, one small town in West Virginia of 390-some people got shipments of 9 million opioid pills over the course of a few years. That should have set off alarm bells within the companies to tell the DEA there's a problem here. But the DEA whistleblowers we talked to said that happened again and again and again.
The CDC estimates nearly 200,000 people have died from opioid overdoses from 1999 to 2015. For more on this, we're joined by Washington Post reporters Lenny Bernstein and Scott Hyam. Welcome to you both. Incredible reporting. Lenny, I want to begin with you. You've both reported extensively on this crisis. Give us an idea of how Congress actually, in critics' view, made the problem worse.
Well, what Congress did is that it took away the DEA's most potent weapon against these huge companies that distribute opioids to pharmacies and doctors and other places where you and I purchase them and consume them. So these are the companies that bring the opioids, the pills, from manufacturers down to the dispensers. And what the DEA used to be able to do when in the most egregious cases was to go in there and immediately lock up their drugs and say, you guys are ignoring the law to such an extent that we're going to stop the flow of drugs right here, right now. Congress took that away.
And explain, if you could, Scott, how did this law come to be in the first place?
Well, you know, the DEA for years was trying to get on top of this problem, and they began by, locking up doctors, going after bad pharmacies, shutting down pill mills. But they quickly realized they were kind of playing a game of whack-a-mole, and as soon as they would, arrest a doctor or shut down a pill mill, another one would open. So they went up the supply chain up to the distribution level that Lenny was just mentioning, and they began to do enforcement actions against those companies, and they began to hit them with fines. They began to lock up their drugs, and the companies started to push back. They began to lobby Congress. They began to recruit some of the best and brightest people from the DEA, from this tiny division within the DEA that regulates the pharmaceutical industry, put them on their payrolls, bring them into the law firms that represented the industry. And one of those lawyers, a senior DEA lawyer, helped actually craft this legislation.
What's wrong with this picture, basically? So he was alarmed, so he tried to go after the drug distributors, and guess what happened? The government passed a bill that said the DEA can't go after the drug distributors. They wanted people to get these drugs if they needed it, was their excuse. Now you might ask yourself, when all these people are dying, why would the government not pass a bill saying you can't go after drug distributors? The reason is they're addicted to something else. It's called money. In 2016, the pharmaceutical industry spent $246 million lobbying members of Congress. In the last 10 years, they spent $2.4 billion. In comparison, the gun rights lobby spent just $10.5 million. That's 4% of what the pharmaceutical industry spent. And then, October 26, 2017, President Trump declared that the opioid crisis is a health emergency.
Effective today, my administration is officially declaring the opioid crisis a national public health emergency.
Unfortunately, he is attempting to repeal Obamacare and cut Medicaid. If Obamacare and Medicaid are cut, it's less likely that someone will have the insurance to pay for addiction treatment. It could then leave millions of people who are addicted to drugs without the means to pay for treatment.
And in 2016, the CDC issued a startling warning. There was no good evidence that opioids were an effective treatment for chronic pain beyond 6 weeks.
In January of this year, it was reported in the U.S. News and World Report that as of January 1st, 2018, Ohio residents with work-related back injuries are required by law to undergo at least 60 days of rest, PT, or chiropractic care before turning to opioid painkillers. The state has been among the hardest hit by the opioid crisis, which many experts say stems largely from addictions to prescription painkillers that can progress into heroin use.
Now I'm going to talk about the 7-point pain-free protocol. Number 1, eliminate all allergic foods. If you're allergic to foods, what happens is your body gets inflamed. One example of inflammation is bloating. Bloating is actually your friend. It's telling you not to eat. A lot of people ignore that. One of the biggest, most common allergic reactions is weight gain, and you feel a little tired and bloated. Most people just ignore that and they just move on. But that's a sign that your body is allergic or sensitive to the food. If you're allergic to it, your body gets inflamed, it increases pain. The most common food allergies are wheat, dairy, the nightshade family, that's eggplant, bell pepper, tomato, potato, cayenne pepper, paprika, and also corn and soy and coffee and chocolate. And some people say, what else is there? So the main thing is to see when you eat those foods if you're reacting to it. Okay, you don't have to avoid all those. The second, part 2 is supplements. Now, one of the best ways to reduce inflammation is to take fish oil, because the way to increase inflammation is arachidonic acid. If you eat corn and soy, or fish or chicken that's fed corn and soy, that will increase inflammation because the arachidonic acid is really high. You take fish oil, it reduces inflammation. It's important to have your arachidonic acid and EPA levels tested, the ratio tested, because people who are homicidal, suicidal, they have a lot of inflammation. You can tell by that test, and it's very easy to lower that inflammation.
To measure the AA-EPA ratio, order Lipid Lab's Holman Omega-3 test. Go to www.lipidlab.com and request a test kit.
Then there's also hemp oil. Hemp oil is good for chronic pain and inflammation, also anxiety, panic attacks, PTSD. There's 2 major neurotransmitters, dopamine and serotonin. If you're low in dopamine, you have a lack of drive and motivation. Low in serotonin, you get depressed. So there are supplements you can take to boost your dopamine and your serotonin. There's also foods you can eat as well that boost those. And then chiropractic. Chiropractic science has proven over 120 years the relationship between the nervous system and the pain-free function of the body by taking pressure off nerves that cause pain. Chiropractic also improves posture, range of motion, and which prevents future pain. There was a study done, a chronic spinal pain randomized clinical trial comparing medicine, acupuncture, and spinal manipulation, reported in the July 15th issue of 2003 of Spine magazine. It was reported that chiropractic was 5 times more effective than drugs or acupuncture, and it also, they did a 1-year follow-up, and those benefits stayed. Another thing is fascia. The fascia is the covering of the muscle. It gives shape to your posture. If your fascia is tight, it will cause pain. You stretch the fascia, it gets rid of the pain.
Fascia comes from the Latin meaning bands. Fascia is a sheet or band of fibrous tissue that lies deep to the skin and encloses muscles, organs, and bones. It serves to contain the body and give it form. But when the body's form becomes distorted through accident or prolonged bad posture, it can become a restrictive shell, trapping the body and inhibiting freedom of movement. By reshaping the fascia, which contains the musculoskeletal system, we can reshape the body to improve posture, increase flexibility, and restore a natural balance. If you'd like to learn more about fascial alignment stretch technique, FAST, go to chirovideo.com.
Body restoration technique is a chiropractic technique. It finds out which organ is related to the pain, and you do acupressure and breathing, reduces the pain that way. So when I adjust patients, if they still have pain, we'll do that on them.
To learn more about body restoration technique, call Dr. Eric Berg, 703-354-7336, or go to www.drberg.com. drberg.com.
And then emotional armoring. So if you have armor, you need to work on that, clear that out. An example of it, if you want to yell and scream at somebody at the same time, not do that because it's not polite. The conflict between the two will cause chronic tension in the body, and it can cause pain as well.
The concept of armor was developed by Wilhelm Reich. Reich attended the University of Vienna in the early part of the 20th century, where he had the opportunity to associate with such giants as Sigmund Freud. One of his primary contributions to the field of psychology is his recognition that mental and emotional conflicts are in fact rooted in the body. All modern psychotherapies that work with the body can be traced back to him. Reich's concept of armor is that of a muscle spasm due to an unexpressed emotion. All emotional conflicts and blockages reside in the muscles of the body, forming what he called body armor. Body armor serves the function of encasing the body in a protective muscular shell. This keeps out not only painful, but also pleasurable stimuli. Armor impedes the flow of breath, life, and emotions throughout the body. Reich reasoned that if character armor, which contributes to unhappiness, actually resides in the body, one could relieve and dissolve the armor, and thereby the neurosis, by working directly with the body. Armor can occur in any organ, or on top of any vertebrae, or in any muscle.
If you'd like to learn more about chakra armor release of emotions, CARE, go to chirovideo.com.
And then stabilize your spine. If your spine is unstable, your nervous system is unstable, your emotions are unstable, and you'll be in chronic pain. So the first thing I do in an exam, find out why the spine's unstable. Do they have weak muscles, problems with the feet, the knees, etc., emotional blocks.
If you'd like to learn more about 12 causes of an unstable spine, go to chirovideo.com.
I'd like to read a testimonial from a patient of mine who was visiting from Germany. Dear Dr. Rettner, it was a wonderful experience meeting you. As a mother of 4 children with a full-time job, I lived with great pain for the last 10 years. The pain was located in my neck, back, pelvis, and legs. Throughout this period, I saw many doctors, professors, and specialists to relieve my pain, all to no avail. Recommendations included cortisone shots, surgery, and early retirement, but all meant living with the pain. Upon visiting my daughter, I reluctantly agreed to see you at my daughter's request. After your first treatment, I experienced great relief from the pain and look forward to the next visit. After my 3rd visit, I felt no pain whatsoever. For me, this was simply a miracle. For you, Dr. Rettner, in your words, it was an easy case. Now I am no longer restricted in my movements. I crawl with my grandson on the floor and laugh with tremendous joy, as nobody except me, myself, can really understand what it means to be free of pain after 10 years of suffering. Even though I had my doubts, the results far surpassed my expectations and made my stay in California a wonderful experience, which I will treasure always. I now have a future filled with hope, health, and happiness. My only regret is that there are others who suffer as I did and don't need to. With many thanks, Hannelore Stokler.
In the Jewish book of wisdom, the Talmud, it says, whoever saves a single life is considered to save the whole world.
In summary, the opioid epidemic is a crisis situation. The government is not doing enough to help. People are dying every day. Chiropractic is a natural, effective solution. Can I see a show of hands? How many of you know someone who had a pain or has a pain that couldn't get rid of on their own? Okay. So how many of you would like to save a life if you could, or improve a life? And a new day has come. Pain-free is possible. And no more painkillers. Enough. With knowledge, you have responsibility. If you know someone who's in pain, I would love to help them get out of pain naturally without drugs or surgery. It could improve the quality of their life and possibly save their life. I'd also like to meet with any of you one-to-one, so just give me your card and we'll talk, and we can help our patients benefit more from a holistic approach. So thank you very much.
If you would like a copy of my ebook, 7 Secrets to Eliminating Chronic Pain, go to drrettner.com, enter your email address, and download a copy. If you are suffering from chronic pain and would like to make an appointment to see Dr. Rettner, he can be reached at 925-962-9160 or by email at drrettner@sbcglobal.net.